So I think we should go ahead and get started. I'm very excited to introduce this talk today. My friend Dr. Kimberly Manning will be talking to us about From Bystander to Upstander, Advocacy in Action. She is a rising professor in medicine in the Division of General Internal Medicine. She's the Associate Vice Chair for Diversity, Equity, and Inclusion for the Department of Medicine. She's the Program Director for the Transitional Year Residency Training Program. Kimberly also is an incredibly sought after visiting faculty member. I have a steady stream of emails into my inbox from people across the country who are like, look who we just got scheduled to speak to us. And I thought it was pretty shameful that we hadn't scheduled her to speak at her home institution for Grand Rounds. So I am thrilled that you accepted our invitation and very excited to hear what you have to say. I think this is such an important topic. We talk so much about implicit bias, but I think we need to know what the next steps are. So thank you, Kimberly.
Hi, everybody. Thank you so much, Wendy, for the invitation. And just really excited to talk about this topic today. While I do not have any, let's see, it's not working. Oh, I'm not advancing. Thank you. While I don't have any financial disclosures, I do always like to disclose before any lecture that any talk that I prepare and give is a talk for me too. And especially around a topic like this, instead of seeing this as me, an underrepresented minority in a diversity leadership role, standing in front of you, telling you what to do or not do, see it as us in a huddle together, thinking about and talking about ways to do better and to be better together. I thought it was pretty cool that it is February 4th and it is the first Grand Rounds of February, which means it is also the first Grand Rounds of Black History Month. And so I couldn't let this moment pass without starting with a little bit of Black history that is relevant to our department. This is Janice Lee. Janice Lee, many of you know her as a nephrologist in the Division of Renal Diseases. Janice Lee came here as a resident and then stayed on as faculty, but the reason I have her picture up is because in 2009, Janice Lee became the first African-American woman to reach the rank of full professor in the Department of Medicine at Emory. That was followed by Dr. Jada Bussey Jones, who then reached the rank of full professor. You all know Stacy Higgins, she became full professor next. And then also this year, Jennifer Christie became full professor. And I got notified in December, so hey. But what I'll show you is that these are people that are here right now, that you know right now, and that history, Black or otherwise, is always happening and is in the making. But recognizing how recent these developments are, these firsts are, it lets us know that conversations like this that make people more comfortable in the work environment are closely connected to achievement and likelihood to stick around and make it to points like this. Just to add a little more emphasis to this, this is the number of individuals who are full professors in US medical schools as of 2018, according to the AAMC. This is the number of African-American women who are full professors. And so these are exciting times for us at Emory. I'm excited to join these ranks, and I'm very, very inspired to be here to be able to share this information. So do know we have work to do, but we're doing it. Many who know me know that I like to tell stories because I believe that stories are impactful and teach us the most. And so do know that the stories that I will tell you, they are all true. Some details are changed to protect anonymity, but they happened at this institution, but could have happened anywhere, quite frankly. So picture this, a team of folks, a surgical team comes into a room to see a patient at one of our hospitals. The patient is post-operative day 1, has some wounds to be changed, and the entire team approaches the bed. And the team is made up of a chief resident, a senior resident, 2 interns, and 2 medical students. Everybody on the team is dressed identically. Everyone has on those hospital issue blue scrubs, white coats. The medical students have on their short white coats. And as they approach the bed to the patient looks over at one of the members of the team, pushes her tray toward that individual with a very nice smile and says, "I really wasn't very hungry. You can take this away." The person she was speaking to was a medical student at Emory who had on exactly the same thing as everyone else on the team, except in her ponytail was made up of African braids. And in the moment, the student froze and said, "Oh, I'm a medical student. I'm a member of the team." And she said, "Oh, I'm sorry." And she looked to the side at the rest of the team to see what would happen next. And what happened next is the wound got changed. They walked out of the room. Nobody said anything else. And that was it. The student was in my small group, so she called me from a stairwell crying. And I didn't even really know what to say to that. But the part that stung the most for her was that no one said anything. No one did anything. And maybe people were stunned. Maybe people weren't sure what to do. But that is one of the things we're going to be talking about today. Just knowing how to respond when something happens in ways that fit for you, because each one of us is different. And I hope you'll walk away from here with some tools for what to do in these situations, which are indeed happening every single day. And so our objectives are pretty straightforward. We'll talk about the what, like what is meant by you being a bystander or an upstander. We'll talk about something called the bystander effect, which is the thing that paralyzes us in groups sometimes where we really want to do or say something, but we just don't. Why does that happen? We'll talk about when we might have opportunities to be upstanders for individuals. We'll talk a little bit, not so much in the context of sexual misconduct, although a lot of this can be applied to that, but also in the context of microaggressions, which is a word that many find abrasive sometimes, but stay with me because I will share with you a little bit of information about why it's important for us to use that word. Why we do this? Why? Because if we have safer learning and working environments, right? People can become the next Janice Lee, the next Jennifer Christie, the next Stacey Higgins, right? They won't leave, they won't hide, but also patients will get better care because we're learning more and able to do better. But especially we'll talk about how in a way that works for you, not in a way that makes you feel bad or like you did the wrong thing, but how you can take you and your individual self and say, what things can I do to stand up for my colleagues, for the people who work for me in my division, for my students, for my patients? So a bystander, it's pretty simple. I found it right on Merriam-Webster, so many of you know what it is, but it's when you're present in a situation, but you're not a part of it. You're just a chance spectator. You're walking by and you see something happen, that makes you a bystander. But the bystander effect is well described, and it describes this phenomenon where the larger the group of people when something happens, the less likely you are to do something. In fact, there's data that supports if it's just you by yourself and you witness a cardiac arrest, you are 85% likely to do something. Call 911. You're a first-year medical student. I'm gonna try to do some chest compressions. I'm gonna try to do something. But as that number increases of people around you, that number decreases of what you're likely to do. And this is just from Pose because that's one of my favorite TV shows. So why does the bystander effect happen? First, there's just 4 parts to this. One is diffusion of responsibility. We've all been there. You thought somebody else was going to do it. I deal with this in my house every day with my 2 sons when I ask, why didn't y'all pull in these trash cans that were in front of my driveway? We thought somebody else was going to do it. This person was here, this person was here, this person was here. Well, I just thought someone else would do it. A big thing that we don't talk about a lot is ambiguity, right? Wait, was that wrong, what was just said? Wait, was that something that was insensitive that was just said there? Because sometimes we just really aren't sure, right? Particularly when people are in different cultural groups than us, we just aren't sure what's okay and what's not okay. Perceived cost. As I stand here in this room and try not to be nervous as I look at senior leadership on the front row, I recognize that sometimes the hierarchy between where we are in this system can really muzzle you and cause you not to say things because you don't know what's going to happen from you speaking up, particularly important for medical students. And then there's apprehension. You just don't know if you should be the person to say something. Like you might recognize that something was wrong, but maybe I'm not the person who should be saying something. Examples that I think of are when someone feels moral distress about something that is said, for example, about someone who is Black and they are not Black, but the other Black people, they aren't saying anything. So they're like, well, do I say something? Is it for me to speak up? So there are all these things that add up that make it very difficult for us to stand up in situations. But the thing that I haven't really seen described in the literature, which I think really should be described in the literature, is that beyond just the bystander effect, beyond our apprehension, the ambiguity, the perceived cost, there's also the lens through which we see the world. All of us see things through the lens of how we came up, who we are around, who we spend time with. So something can happen, and sometimes you just didn't see it because it wasn't in your lens. And so I want to just give you a few examples about how our lenses affect the way that we see things, recognize things like microaggressions, personal affronts to individuals, and how that can stop us from acting. So I'm going to show you a few images, and some of you, when you see the image, you will know exactly what this is. Raise your hand if you know exactly what this image is from. Raise your hand if you know exactly what this image is from. Raise your hand if you know exactly who this is. Raise your hand if you didn't know who any of those people are, if none of this meant anything to you. Thank you. Okay, I want to show you something else. These are a few names. I'm going to just name them out, and some of them will be familiar to you, or maybe some of them are not familiar at all. Kiki Shepard, Jill Scott, Nia Long, Charlie Wilson, Florida Evans, Elle DeBarge, Donnie Hathaway. Raise your hand if you knew 5 or more of these names. Raise your hand if you knew none of these names. Thank you. Raise your hand if you know exactly who this is. Meatloaf, that's Meatloaf, right? That's Meatloaf. So I want to tell you a little story about Meatloaf. Meatloaf sings a song, which I now know is called Paradise by the Dashboard Lights. When I started my internship, I was one of 2 Blacks in my residency program. And for part of our internship, we went to this dueling piano bar. And my entire intern class was there, and we were all like having a blast, getting to know each other. And these guys jump on this dueling piano bar and they start playing this song by Meatloaf. And let me tell you something, every single person in that Cleveland, Ohio bar in 1996, that is, they knew every single word to this song. And I had never heard it in my entire life. I had no idea what it was. Everybody was jumping up and down. They were like singing and dancing. And it was a really lonely moment for me. And it made me realize that my lens before then, up until that time, had been very different from the people I was around. And so this was me in that moment. In fact, I just kind of moved my mouth and tried to fit in. But really, that's how I was feeling. Furthermore, there were some things over time that I did come to know. This is one that comes to mind, the Sweet Caroline song, except where I come from, I didn't know that I was supposed to say, so good, so good. See, nobody told me that part because it wasn't in my lens, right? So even though I work at Grady Hospital, and a lot of people in this room have worked in Grady Hospital, my lens that I've seen the world through and how it is shaped is very different from some of the other folks here. So I am an African-American woman from inner city Los Angeles whose parents come from Alabama. I'm married to a Black man. I have 2 Black sons. I'm a descendant of US slavery. That shapes my lens and how I see the world and how I see caring for patients. I attended not only 1, but 2 historically Black colleges before attending residency. I went to Tuskegee University and then Meharry Medical College, which greatly shapes the way I view and see the world. My sons wear their hair in natural hairstyles like twists, and my younger son is asking me for locks right now. That shapes the way I see hair and the way I see the presentation of individuals' culture. This is one of my best friends, Dr. David Malebranche, who is a same gender loving Black man. And because of my proximity to him, that shapes the way I see the world as well and how I feel and react to things that I hear. I work closely with students who are from underrepresented backgrounds, which again, because I was that student, that shapes my lens as well. I am the sister to a woman named Deanna Draper, who died of a sudden cardiac death in 2012. She was overweight for her entire life. And how I see people interacting with people who are overweight is shaped by my relationship with my sister and her sudden death. I'm married to an Army veteran, a Ranger, a tough guy. But because of my close proximity to a veteran, that also shapes my lens and how I see things, what I respond to, what offends me, what I notice, right? But there are also things I don't notice, right? Just because there are things I do notice, it doesn't mean that there aren't a whole bunch of things out of my lens. So I'm gonna have you take a moment, pair and share. You're gonna have to talk to the person next to you for a few moments. And I want you to look at this list. And I want you to pick 3 things on this list that I have to think about every single day. I'm always thinking about these things. And 3 things that you never have to think about. You just don't have to think about them. Take a moment. Okay. So we have some pairing and sharing going on in here. And because I'm video conferencing, I won't start asking you all your input. But what I will say is that this is a powerful exercise in helping you to look at what your lens is. So a few things that I do think about every single day is, every single day I think about my race. I think about that every single day. I'm always aware of my race everywhere that I go. I'm also constantly thinking about my loved one's safety. My husband, every time I hear the garage door open, every time I hear his car pull over the little thing in our driveway and I hear it go click, click, I breathe a sigh of relief. I'm happy, I'm relieved. And I'm not just exaggerating. I am really happy and relieved that he's made it home. Now that my younger son, my older son is 14 years old, when he gets home, I'm really, really happy that he got home. I also think every single day about, I think about how I talk. I think about that. I think about who I am talking to and how I sound. I think about that all the time. I'm very aware of that. Now, let me tell you some things I don't ever really have to think about. I don't really have to think very much about my gender identity or gender expression. I don't. I'm a cisgender woman, and I just don't really think about that much. I also don't really think very much about my religious expression. I don't think about that very much. I'm certain there are people in this room who do, though, constantly. And then furthermore, other things that I don't really think about every day is I don't think about my sexual preference every day. And again, there are individuals who do have to think about those things every day. And so I'm showing you this to show you that sometimes the things that we say or do, though they are not intentionally insensitive, what they represent is that our lenses are so very different from one another. And so it's our job to build environments that broaden our lens, right? So this matters because your lens is shaped by your individual exposures. And that's why things like diverse environments, exposure to people who are not like you, bias training and cultural competency matter because they will help you to see the things that otherwise you may be blind to. Share this with you.
For people who still don't think that microaggressions are a problem,
Oh, you're so well spoken.
oh, just imagine instead of being a stupid comment, a microaggression is a mosquito bite.
Ugh, it's a compliment.
Mosquito bites and their itch are one of nature's most annoying features. But if you're only bitten every once in a while,
No, where are you really from?
Cleveland.
Sure, it's annoying, but it's not that big a deal. The problem is that some people get bitten by mosquitoes a lot more than other people. I mean, a lot more. Whether it's on a date,
Oh, your English is so good.
Excuse me?
going grocery shopping,
You know, everything happens for a reason.
I'm just buying apples.
commuting to work,
So when are you gonna have a baby?
watching TV,
We have to keep the Redskins name. It's part of our culture and history.
or just walking down the street with your partner.
I couldn't even tell you were gay.
Mosquitoes seem to pop up everywhere.
Do you know John? Give shopping advice.
So bad
I
now.
love Cher too.
And getting bit by mosquitoes every damn day,
Can I touch your hair?
multiple times a day,
So pretty. Can I
Can I
touch
touch
your
it,
hair?
please? Can I please?
is annoying. That makes you want to go ballistic on those mosquitoes, which seems like a huge overreaction to people who only get bit every once in a while.
It's just a mosquito bite. Who cares?
Just another angry black one.
Of course, beyond just being annoying, some mosquitoes carry truly threatening diseases that can mess up your life for years.
Astrophysics? Maybe you should try less challenging, Major.
Ow, my dreams.
And other mosquitoes carry strains that can even kill you.
He looked like he was up to trouble, okay? I felt threatened.
So next time you think someone's overreacting, just remember, some people experience mosquito bites all the time.
You're all so exotic. Wow.
And by mosquito bites, we mean microaggressions.
Okay. So talking a little bit about microaggressions is a great segue for this awesome paper that just came out last month in Academic Medicine. And it looks at going from implicit bias to actually being able to transform the way we think and what we do. And the focus is on something called transformative learning theory, which isn't a new concept. It's actually a concept that was first described in the 70s, but they overlay what we do with implicit bias and how we move to action. And so I'll share a little bit with you about what that means. So transformative learning theory, we can apply it to pretty much just about anything we do, but for this context that we're talking about today, also as described in this paper, I really want you to kind of roll with me here for a moment. So the first part in transformative learning theory is disruption and a revised interpretation of how you think. So disruption, for example, this word microaggression, I've had lots of conversations with people around the word microaggression. It suggests that somebody intentionally did something wrong, and some people find it very offensive and difficult to embrace. But instead of looking at it as a personal affront, I ask that you look at the word microaggression as a disruptive word, something meant to grab you by the shoulder, shake you, get your attention, and revise your interpretation of something that's happening in front of you, not so much meant to offend you. The next step after you get your shoulders shaken a little bit is critical reflection, to think about, well, what am I doing every day? When we talked about those things you don't have to think about every day and that you do think about every day, to know that someone sitting beside you is constantly relieved when their husband gets home each day because they're afraid that they could get shot and killed on the way home. That's something that could lead to some critical reflection for all of us, and some sensitivity from all of us as well. And then conversations, dialogue, talking about what you learned, what you saw, what you didn't know, to help kind of broaden, again, that lens, which ultimately leads to action. And so I use that in the context of talking about microaggression as a word, because again, it's a word that sometimes can push people away and be a conversation stopper. Instead, look at it as a disruptor. So here's what we've gotten so far. We've gotten so far is we now know what the bystander effect is, right? We know that the more people that are around, the less likely you are to do something. Maybe somebody in that room with that student who was referred to as the food services person, maybe they wanted to do something. Maybe they thought something was wrong, but they didn't act because of the bystander effect. We all have varied life lenses. Maybe somebody in that group didn't even notice that anything happened. Maybe they didn't even see that something happened wrong. Or maybe they thought, what was the big deal? She just mistook you for the food services person. What's the big deal? But also you learned about the transformative learning theory, this idea that first we have to disrupt the way that we think, lead to some critical reflection about what's happening around us, have dialogue with one another, and then ultimately that is what leads to change. And that is where we're going next. What do you do when these things happen around you? How can we move from bystander to upstander? Well, the first step is to notice that something happened, right? So we already talked about the things that could stop us from noticing what's going on. Next is to evaluate the situation and say, okay, what should I do right now? How urgent is it? How high are the stakes? What should I do? But then last, to move past the bystander effect into assuming responsibility, saying, I saw it. I feel the moral distress about this. I am aware it is on me to act in some way. And remember, there's lots of different ways to act, and that's what I'll show you next. But before I show you that, I just want to share this with you. This is me giving a talk in one of my favorite dresses. I wore this dress into our medical school less than 1 year ago, and someone saw me and they said, woo, now that's a woman. It was a person I respect. It was a senior faculty member, and I just sort of didn't know what to do. I was like, okay. So let's just talk about just a few rules about what you just should not be doing, okay? Because the person really meant to compliment me, like, I think. But let's just get this out of the way in case people are like not sure about a few things. Let me just help you out. Body commentary, woo, that's a woman. Yeah, don't do that. Racial jokes or slurs, recognize that a lot of the microaggressions that you see, they won't be directed right at the person. They'll be talking to someone else and the other person will be there to be offended. Stereotyping, making fun of people's names, making fun of people's name pronunciations. Even if the person laughs with you about it, even if the person isn't getting mad at you, they're feeling it. They're getting those mosquito bites. Sexually suggestive comments. Reproductive plan preferences. When are you gonna have a baby? When are you gonna have another baby? You're not having a baby? Are you? Don't ask people if they're pregnant. Religious jokes, assumptions based on race, jokes about disabilities and the disabled, LGBTQIA jokes and comments. I would just say as an example, I used to say LGBTQ ... And that in itself was actually offensive to someone who told me like, I'm in the ... I'd rather you just say nothing. And I was like, ooh, thank you for telling me that. So we're always committing things left and right, indirect comments, and then there's probably a whole bunch more you can think of. But recognize that there are just some things that we just need to agree upon that are not okay. Okay, so what do you do? These are the 4 Ds to upstanding, which many of you have heard before. The first one is just to be direct about it. Listen, lady, I'm not the food services person. I'm a medical student. Hey, I'm the senior resident on the team. She's a medical student on our team. She's here to care for you. That's direct, right? But for some people, that is not your personality. It might not fit the setting. The patient might be sick. The patient might be delirious. Who knows what else is going on? But direct is one of the things you can do. The next thing you can do is distract. That can change the subject. Okay, everybody, let's get off of that. Let's move on to this. Delegate. You can go and talk to someone else about what has happened. This is a thing I see commonly with students who witness something that happens. They will come and tell me to get me to help them speak to somebody senior because of, again, where they are in the hierarchy. And then delay, which is something that many people do or wish they could do, which is go to someone afterward and say, hey, are you okay? I heard that happened and I'm so sorry I didn't say anything, but I just want to make sure you're okay. But there is actually one more that never seems to make it into these Ds. So I submit to you that there is a 5th D, and that is displaying discomfort. Because most people that I know who have experienced some form of a microaggression, one of the most painful pieces of it is the indifference that they feel from people around them. They don't see anything in the faces of those around them. So let me show you what I mean by that. Display discomfort. You could do this. You can do this. You can do this. And if you're really feeling fired up, you can do this. But let me tell you, sometimes this goes a long way because someone says something and nobody does anything. It can be really, really hurtful. So I'm just going to share with you a few things that I witnessed or that I was a part of. I'm going to disclose to you right now that each one of these situations, I cannot say that I did the right thing. For some of these things, I was indifferent. I experienced the bystander effect, or it took me a few years to look back on it and realize what happened. The Apple user who wasn't PC, a person got ready to give a lecture. They're standing at the front of the room. Their slides weren't working. They said, these slides are retarded. This is so retarded. I can't stand when you go from Apple to PC. It's so retarded. And they kept saying it over and over and over and over again. And I knew that there was at least one person in our room that had a child with cognitive disabilities in the room. Hot-headed. An individual who wears hijab was in clinic, and someone said, I know your head gets so hot with it. Don't you just want to rip it off in the summer? How do you keep that thing on your head? Oh my goodness. Wow, you're really tall. Instead of being a medical student, maybe you should have played basketball. You could have beat out LeBron. Wow, I don't really know that many people who are Mormon, but how many kids do you have? Like 1 million? To which the resident said, no, not 1 million, like 3. Oh, so like, where are you right now? Like, are you like him or her or they? So where are you in your transition? This trans woman said, I'm a woman. I've already transitioned. So let me get this straight. Now, during Ramadan, you don't eat all day long. So wait. How do you, I don't know how you do it. Now I'm intermittent fasting. So, you know, on and on every day, over and over and over again. So they were a little slow on the fast. I'm really impressed with my witty titles here. I want you to be too. So with each of these things, there are opportunities for you to apply these 5 Ds. And what I want you to think about in these moments is think about with those things, what you would do. Which of these would you use? What is your personality like? Are you somebody that might be direct and in the moment say something firm, clear, concise, right? Sometimes if you're in an authority position, you can do that. Distract, shift the focus. Why are you, yeah, you know what, let's get focused on clinic and stop talking over and over about this colleague and their fast, which is, you know, something very important. So can we change the subject? Delegate, speak to someone else. Hey, Dr. Manning, I was really uncomfortable about what was happening in clinic today and what was said. What could we do? Check in later. I know that you were laughing along with everyone else, but I just wanted to see if you were okay.
Thanks, Fred.
But also, displaying discomfort can also be
After every single meeting, the light I get is going to be this color.
somebody's upstanding right now.
227-579.
Sometimes standing at the bedside, and the team in a semicircle, the entire team was there. At this point, I was now in this role of Associate Vice Chair for Diversity, Equity, and Inclusion, and was thinking a lot more actively about how to be a better bystander. And so the student, who is a South Asian student, starts to explain to a patient how to use an incentive spirometer. The patient interrupts the student mid-sentence and says, "Do you even speak English? Dude, where are you from? Are you even from America? Do you even speak English?" There were 6 or 7 of us on the team there. The student froze, holding the incentive spirometer. I look at the patient and I say, "Sir, he's a member of our team. He's from Florida. He speaks English." He's like, "You know, I'm just playing." I was like, "Okay, sir, come on. Let's." Anyway, the student then commences to teach the patient how to use the incentive spirometer. We walk out of the room. I say to the team, "Okay, guys, what just happened there was a microaggression. I'm super sorry that that happened to you. Let's talk a little bit about, are you okay?" So that was a delay, a check-in later, right? But then I started to think more about my authority position and what I could do. I had a good relationship with the patient. And so the other piece of the delay was that I went back to the patient and talked to the patient a little bit about what happened. And this patient then says, "Oh my goodness, I'm so sorry." The patient then called the student, had the student paged, talked to the student, learned all about where the student was from, and apologized to the team the following day. Now, this isn't always going to be the happy ending that you get, but do recognize that in real time, we can really value our learners and each other and still continue to take care of our patients. Now, the other thing I seem to see missed sometimes in these descriptions is when you are the microaggressor, because it sounds really good for me to tell you about all these terrible things that everybody else did. But do know that many times it will be us who's the one who's saying the wrong thing. I have this picture here with Holly Lewis, who graduated from this medical school last year, who was on the opposite end of quite a few microaggressions from me as her attending physician who had never worked with a trans woman before. So you start with the 5D approach, which we already talked about, but then acknowledge your error. Once you realize that you were wrong, acknowledge it. Autocorrect if mid-sentence you see a look on the person's face that makes it clear that you're going the wrong direction. Make a correction, apologize, call yourself out. If you were wrong, call it out. Acknowledge how the person may have felt, because sometimes the person may say, oh, it was no big deal to me. Well, you could have felt a way that I regret that I said that, and you could have taken it the wrong way. Shut up and listen. Shut up and listen. Tell a trusted friend and colleague what you did. I think that makes it real when you actually go to someone and acknowledge what you did, because that's a good way to kind of anchor down and say, okay, I vow to do better. Promise yourself you'll do better the next time, and then move on. That's a really important piece. Move on, get the lesson and move on, and don't ruminate in it. You can also be an upstander for yourself. This picture was taken when I was a visiting professor at a prestigious institution. I had just given a talk. I was very proud of the moment. I was sitting at a table with 25 people, including a dean. And my talk was about how it was about my journey as a medical student to residency, and how, as much as I love Emory, how I didn't get into the Emory's medical school or residency program, but how I'm here now and to kind of stay at it. It was for medical students. The dean, who was sitting beside me at the table, looks at me and says, you know, that was a really good talk, but like, how do we recognize the ones that are scrappy like you? How do we know that they're going to be scrappy and make it? You know, the ones like you who are going to like end up doing really, really well, even if, you know, they don't really meet the standard. Wow, you invited me here and you paid me to come here, but okay. And I said, well, you know, I didn't really think of myself as scrappy, distract. That's what I tried to do. I don't really think of myself as scrappy. I don't know. I just, you know, I definitely worked hard. I like to call it growth mindset, sir. Yeah, but how do I recognize, you know, like, I want to have more URMs here. I mean, I do, but like, how do I recognize the diamonds in the rough like you? Table with 25 people there. So I start to look at the table to see if I can get somebody to display distress. I want somebody to be like, what? One lady, I think the only thing I saw was one lady was really cutting her chicken really hard. That's one thing I saw, but that was, other than that, everybody was just kind of looking overall amicable, which really hurt even more than what he was saying to me. But see, this wasn't even when I was a full professor yet, but I still stood up for myself. And here's what I ended up saying to this gentleman. I said, sir, you know, I think that the rough has been in the eye of who is looking. I was always a diamond gleaming in the open. To which he said, yeah, and then he ate a piece of his pie and kept going. So I tried to distract and shift the focus, ultimately try to direct approach. But you can stand up for yourself and recognize that upstanding is something sometimes you have to do for you. So remember, step one, notice that something happened. You have to notice that something happened. How will you notice? You will notice by broadening your lens. Recognize that there are sometimes things that you may not see because it just never reached your lens, like me and Meatloaf, right? Evaluate the situation. Did something happen here? Was that wrong? Was that okay? Was that a microaggression? Was that something that was inappropriate? And then assume responsibility. I cannot assume that all of you guys are going to do something, but I can pick one of those Ds or something that works for me and my personality and where I am to act on your behalf in the moment. So here are some takeaways for you. You can be an upstander. You can, no matter who you are. You do not have to be an African-American woman from Inglewood, California, who is the Associate Vice Chair for Diversity, Equity, and Inclusion. You do not have to be that. Anybody can do this for anyone. Notice, evaluate, and assume responsibility. It's all of our job to do that. Noticing can be hard, but you can do it. Broadening your life lens helps, and that's where our diversity, equity, and inclusion efforts come, right? It can broaden our lens to how we see achievement, how we see what's best, how we see what metrics are, right? Microaggressions are real, even if you don't feel them, and even if you don't like the word, but allow that word to disrupt you. Allow it to shake you by the shoulders and cause you to critically reflect on what has happened in front of you. Remember, not just the 4, but the 5 Ds, that sometimes if all you got is just a, that's better than nothing until you're ready to do more. Acknowledging your own missteps makes you an upstander. I should have said an upstander. Doggone it. But that part is really important. I was very clear to let you guys know that there are things that I've done wrong too. And sometimes these discussions, they lead to people just telling you all the things that other people did wrong. But I assure you that I'm making missteps day after day after day, and I'm applying these things as much as I can. So again, this is a discussion and learning for me as well. And then recognize that sometimes the person who you need to stand up for is you. There will be a moment where something happens and you just have to stand up for you. Nobody else will be there to do anything. I will tell you that after that dinner where I was called the scrappy diamond in the rough, I got up from the table and stood by the table waiting to see if somebody would come to me and say, Dr. Manning, I'm sorry that was said to you. That was really uncomfortable. But no one did. People just told me to have a safe trip back to Atlanta. And that hurt me more than what anybody else said or did. The fact that nobody came to my aid. And recognize that your colleagues will feel the same way. What have you missed? What has happened around you that somebody is wishing you would have come over and said something? Some of it was that you were paralyzed, but some of it was your lens. And it's up to all of us to broaden that lens. The last pro tip I'll give you is to be intentional about the learning and working climate, because nobody can delay and come to you later, or no one can delegate to you if they don't feel safe coming to talk to you. This is that student that called me from the stairwell that day. She's a graduate of Stanford. She did her residency at Duke. She's doing a fellowship at UCSF. She's just fine. But these students have to have somebody that they can call, right? And even if she wasn't any of those things, and she hadn't trained at any of those places, she still deserves for somebody to acknowledge where she is and what she's doing. We can all do this, all of us. And so here is your homework, because you need an actionable item that you can take away from here when this is over. Reflect on the list of things you do and don't think about. I actually think that's probably the most important activity that you can do after you walk away from here. Think about what it's like for somebody to have to think every day about how they present themselves through religious expression. Think about what it's like for somebody who's a woman who comes to work every day. Think about someone with a disability, what it's like for them every day. Make a list of 3 perspectives that you don't have to consider. And make up your mind to say, you know what, I'm going to just work on considering those things. Imagine what it would be like to worry about those things. And then think about a time where you witnessed or committed a microaggression. Now, this part right here is actually not that fun, but this is where the growth takes place. When I started thinking about this stuff, I started to recognize list after list after list of things that I missed where I could have stood up for somebody but did not. And then what could you have done differently? What could you have done differently in those situations? Because through that critical reflection, as we think back on that transformative learning theory, that critical reflection is what ultimately will lead to the change that you need. Just want to make a few acknowledgements before I close and open for questions. I would like to acknowledge our quietly confident chair who operates in integrity and who has created a space for us to have conversations like this and to really advance ourselves in terms of diversity, equity, and inclusion in the Department of Medicine. I'd like to also thank mentors like Jada Bussey-Jones and all of the women who've come before me as full professors. And then also those who are learners in our environment who are counting on us to figure this out, to create better spaces so they could just learn in peace and take better care of patients. To our house staff, specifically, also our Church World Diversity and Inclusion Collective, I'd like to thank them for just provoking thought for me and really helping us to be more brave in our efforts and what we talk about in front of large rooms of people. And ultimately, all of this will benefit our patients who need us to be able to learn and grow in ways that allow us to take better care of them. Thank you for having my back by listening to this lecture. Any questions? Thank you.
Dr. Manning, we have a question from the VA.
Okay, hi VA.
I have told people in a variety of settings that you look great after under a recovery, illness, or an injury, or after delivery, and usually they light up in response. Since it involves an appearance, is this a microaggression?
That's a very good question. What I will first say is that I'm not the authority on what is a microaggression and what is not. By definition, people say a microaggression is in how the person receives it, and not has nothing to do with what your intention is. What I will say is that as things evolve, we do have to be extremely careful with things like related to people's bodies. Someone looking great is different than, now that's a woman. That's a little bit different. I imagine it will also depend upon the context. If an individual is in the hospital and they've been sick and tired and now they're sitting up in the bed bright-eyed and bushy-tailed and you say you look great, or you were out with the flu or you had a surgery and you're back and you look great, in context that could be potentially okay. But I will just say again, when there is a dichotomy between genders, use care. You look healthier. I'm glad you're better. Other questions? Dr. Christie, Professor of Medicine.
Sorry, thank you. Thank you, that was excellent, Dr. Manning. So yeah, it being another African-American woman, oftentimes I do find that it becomes our burden to recognize everything, right? And be that, to be the upstander. I mean, how do you tackle it? Because there are times when you're focused on that patient's illness, right? And you miss it, right? But at the same time, you have to be, as you said, conscious and cognizant of all the other social dynamics going on around the team. And, I don't know. I just find it to be very challenging. I don't know if you have any comments about that.
Thank you for that question. And the question is about how there's so many things that we're juggling in our environment already. How do we shoulder the burden, particularly for those who are underrepresented? How do we shoulder the burden of taking care of a patient, keeping them alive, and also noticing that, somebody just committed a microaggression? Well, I don't have, again, the perfect answer to all of those things, but what I will say is, like anything that we do in medicine, it's always evolving and we have to just be open to learning. I find that we do a pretty good job keeping track of a lot of things. We learned how to use electronic medical records. When I got to Grady, I was writing on charts. We learn a lot of things and then integrate them into what we're doing. And so I just think that it is our responsibility, not just for those of us who are underrepresented, but everyone, to broaden our lens and start to be able to see the things that are happening around us. And I would just charge everyone to say, don't make it so heavy. It's not as heavy as we think it is. It really is just, as simple as if someone is walking across this floor and they trip and fall down, because my natural response is, are you okay? Right? But so as we start to practice this more and more and more, the aspiration is that this will become more reflexive for us. Someone says something, you're like, yo, you can't say that. That's not okay. Instead of making it into something that is a really difficult thing for us to do. We just have to kind of flex the muscle until it gets stronger. Any other questions or comments? Dr. Dressler?
Thank you very much. That was superb. how do we bring this kind of teaching and training at the early learner level? Like, are there, I'm just trying to think about, are there ways to, because from my perspective, I would say like, oh, I would love to bring this in and do real life situations and scenarios, but how do we, are there ways to do that in sensitive ways, or were you really just going to tap dance around it, say, well, let's talk about it, never really put you in the situation, and then I guess I would feel that that's just going to like, oh, well, you'll be in the situation when you're in it, and let me never let you practice it. I'm just interested in your perspective.
Yeah, so thank you, Dr. Dressler. The question and comment was that how do we integrate bystander and upstander training into early education for our students, and instead of just saying, okay, when it happens, you'll know what to do. It actually brings to mind something that Dr. Spell and I were talking about this recent episode on Hidden Brain, where they talked about what you think you're going to do isn't actually what you end up doing. There's a whole episode around that. Everybody thinks they're going to, oh, I would have jumped in that lady's face and told her this, but that's actually not what people end up doing in real life. And so to answer your question, the way to build anything into a curriculum is just to do it, right? So we, fortunately at Emory, we have a structure that would afford us the opportunity to do that. Early in the M1 year, we have a discussion about culture and diversity, but there's definitely more room for us to do more active, interactive things in terms of bystander training. There are some institutions that use videos. We had UVA come visit us, and they did some videos with bystander role plays. But I also think that in involving our students and hearing about real microaggressions that happened anonymously, and then us using those for our role plays, I think that makes it more real. It doesn't really, it's not meant to make anybody feel uncomfortable. It's just to know that this is really happening every single day. Dr. Del Rio.
Thanks, that was terrific. You know, we talk about training, I was thinking about that, but I was also thinking about just the hidden curriculum. I mean, you can do whatever you want within the classroom, and then you get to the real situation and it changes. And I think what you're saying is exactly right. Is on the moment that bedside teaching, that micro teaching that has to happen, because if you don't do the intervention, then you can have all the curriculum, and then that moment just destroys everything. So I think the challenge is how do we, you know, in this fast moving world in which we're all running from here to there, and how do we just take the time to address these issues and really think how important it is that we don't let the hidden curriculum take over. Yeah. And I don't know if you have any recommendations for that.
Yeah, I'll just say, just gotta watch time. I'll just say that first, again, the comment and question was that the hidden curriculum, which for those who don't know what the hidden curriculum is, it's all the things we're learning that are happening around us that aren't a part of the formal curriculum, how that affects us, and then how do we take the time to do what we need to grow and to be better. I think step one is just like that piece of the homework. Listen, if all of this overwhelmed you, if you were just willing to pick one of those things and say, you know what I'm gonna do? I'm just going to think of 3 things that I don't have to think about every day. And then I'm going to just try to pick one of those Ds that I think might fit my personality. And particularly for those in leadership roles, making up your mind, charging yourself to do at least one of those things. I think that for those of us who are in leadership roles and who have teams with us, I think we will give voice to our learners by us modeling upstanding first. I feel really confident that the members of the team that all participated in that bystander moment for Avanage when that happened at Grady that day, I think that those members of that team are much more likely to do something the next time because they saw it happen. And then the more you stand up, the braver that we get. The last thing I'll tell you is that the hidden curriculum is not always negative. Do remember that the hidden curriculum can be a very, very positive thing, because if the hidden curriculum, if I'm in clinic and somebody commits a microaggression against my Muslim resident and starts asking a bunch of questions and I say something in that moment to stand up, that's a piece of the hidden curriculum too, which says in this setting, we don't stand for that. That's not okay. That's not what we do. And then it starts to permeate. One little thing I'll tell you that's a stand-up thing is we had a resident in our clinic who is coming back to the faculty. Mahmoud is now going to be in heart failure, and he was in my clinic, and all of us were saying his name wrong. And I said, I want to learn how to say your name like your mama says it. So he taught everybody in the clinic how to say his name. And what ended up happening is the entire clinic started saying everybody's name correctly because everybody committed to learning how to say Mahmoud. And so that's a hidden curriculum thing that I think is positive. It's not always a bad thing. We just have to kind of shape it and be aware. Dr. Spell.
Yeah, thank you. I was going to just say in comment to Dr. Del Rio's question, but also I think you just hit it too, is to me, this feels like a co-learning opportunity. Mm-hmm. So, you know, I doubt there's very many people in this room who would raise their hand if asked who in here is an expert in this, right? So I think, you know, to me, the thing is, how can we as faculty or even a resident to your student, how do you create an environment that says, I'm learning this too. It's okay for us to talk about it. I want to learn from you. I want to learn from our patients. And then we're modeling the fact that we're lifelong learners here and that we're going to get it wrong too. I think that is, as you said earlier, one of the most powerful things that we can do.
For sure. With some of my ward teams, I've had bias rounds where I just run the list and I look at where my biases are. I say, oh, I know I have a strong automatic preference for patients who are thin compared to patients who are overweight. And so I know that's one of my biases that I'm having. And this patient on top of that has some mental health things. So that is a patient I'm going to go and see first. I'm not going to wait until I'm hungry and tired and exhausted to go and see that patient. Just calling it out. Not your bias, but I'm biased and I'm just going to tell you what my biases are. And so again, that's a hidden curriculum thing, because if you start doing that in front of your teams as a leader, they're like, well, shoot, Dr. Manning is all messed up too. I can just tell all the things that I do wrong as well. So I think we can just kind of come out of hiding and recognize that we are all biased. We all look at life through different lenses. A lot of you have no idea who Florida Evans and Frankie Beverly is, and those pictures that I showed you, those images that I showed you before, you should know that they are things that are quickly recognizable to anybody who is immersed in African-American culture. Those were very, very everyday images to me that, like, I can't believe you don't know what this is. But just like my classmates couldn't believe I didn't know who Meatloaf was, or I didn't know to say, so good, so good, so good. I think it's 1 o'clock, guys. I really appreciate your attention. Thank you so much.